All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. Thank you for attending this webinar on how to create a billing and coding chiropractic compliance manual. Just a quick disclaimer before we get going. The information in this program is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target Coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this program is 100% accurate. However, it's not guaranteed. Now, we have a lot of people listening to this webinar. Some of you are members of Target Coding, and some of you have no idea who I am. So let me tell you a little bit about myself before we get going. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I am also a certified professional compliance officer and a certified billing and coding specialist. That's what all those letters are after my name. My area of expertise is in coding, billing, cash practice compliance, documentation, risk management, record keeping, Medicare, DME, and HIPAA. You know, I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders, and most certified coders are not chiropractors. So you'll see during this program how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Now, Target Coding members listening to this, after you finish listening to this webinar, you'll have the opportunity to receive the playback recording just in case you wanted to listen to it again, or maybe you fell asleep, or you have a staff member that's not available to listen to the live version. So you'll get the playback recording, and you will also get a certificate of attendance. Just sign into your account to get your certificate of attendance. And we recommend you place your certificate of attendance in your billing and coding compliance manual that we're going to be going over today. Use your certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. Okay, let's get started. How to create a billing and coding compliance manual. The best way for me to explain this to you is to show you an example of the one that we provide to doctors across the country. We've written over 300 compliance manuals for chiropractors and integrated practices throughout the United States. So I'm going to show you a sample of Target Coding's Billing and Coding Compliance Manual. Now, some of you may already have a compliance manual, so yours is probably going to look different than ours. I mentioned earlier, I take my 16 years of experience seeing patients in the trenches, knowing that you need to do as a chiropractor, and combine it with my expertise in compliance and how to create manuals. So we've come up with one that is very simple, basic, and addresses the key topics. You'll see in a few minutes how nice and simple this is with great language. Our policy manual has 3 sections. Policies and procedures is section 1. Forms is section 2. And you'll see the miscellaneous documents that we provide in section 3. So let's begin with section 1, general overview. This is the language that we've created for our clients. It's simple, it's basic. You want to use the language that I've created. It's for your protection. It'll help you SWAN. You ever hear that acronym, SWAN, S-W-A-N? It'll help you sleep well at night. So this is what your compliance manual should say. We developed a compliance manual. It's meant to be an extension of our mission and values. The success of any organization is dependent upon trust between ourselves and our patients. While this plan is detailed, it's not all-encompassing. We're not going to be able to address every situation. It'll never be a replacement for making good, ethical, logical choices that you doctors or your staff members would make acting in good faith. So now, what do I base this compliance manual on? The OIG, you've probably heard of the OIG if you've been in practice for a while. Now, I know we have brand new doctors of chiropractic listening to this webinar, just graduated chiropractic school. So there are some terms you probably never heard of. And then we also have offices that have been practiced 15, 20, 25 years listening to this. So you know what the OIG is. The Office of Inspector General recommends 7 elements. 7 elements should be part of your compliance manual. First element is policies and procedures. No problem. I'll show you the ones we've put together. Leadership. I would say 99% of the doctors we work with are good leaders. And as good leaders, you would need to appoint a billing and coding office manager who will report directly to the business owner. Number 3, training. Of course, you'll need to document your billing and coding trainings. How do you do that? We'll show you. It's simple. It's basically a spreadsheet. You document who attended the meeting, how often they're being done, comments, very simple. We show you how to do that. Number 4, communication. 99% of the chiropractors that we work with have an open door policy. If a staff member or a patient has a concern, the business owner, the chiropractor is going to say, hey, we have an open door policy. We encourage communication. Tell me, what's your concern? Number 5, disciplinary action. Yeah, we have a client right now that has an associate chiropractor that's not doing what he is supposed to be doing. So we've gone through trainings. The problem is on documentation. The associate chiropractor is refusing to document properly. So we're going through the disciplinary actions, and this associate chiropractor might need to be relieved of his duties if he doesn't follow the policies. Number 6, auditing and monitoring. This is the most important part of a compliance plan. It's doing self-tests, checking your own notes, making sure it's correct. Where you test yourself, we show you how to do it. I've created an audit tool. You know, I look at it like, you ever watch the show Jeopardy? I'm sure all of you have heard the show Jeopardy. You watch that show to see if you could answer the questions. You're testing your own knowledge. So that's what this is, number 6. You're testing your own abilities to document properly. We show you how to do it. And number 7, if there is a concern, if a patient, an insurance company, an employee has a concern, how do you investigate the process? It's like a fire drill. Hopefully you never have to deal with a fire, so you practice fire drills. That's what we do with number 7, a checklist. So now every office needs a billing and coding office manager. 99% of the offices we work with hire an office manager to be named the office billing and coding office manager. 1% of the offices we work with, the chiropractor names him or herself the office manager. So the billing and coding office manager has to comply and understand regulatory requirements, has to know how to update internal policies, has skills to train and raise awareness, and has to sign a form. I'll show you a sample form that would need to be signed. Every good quality compliance manual should have a mission statement. I would say 80% of the offices where we create a manual, they don't have a mission statement. So we show you our mission statement. There it is on the screen. You may like it. You may want to change the verbiage. You should also have core values in your policy manual. Here are the 19 policies. We've narrowed it down. We have some clients that they've showed us their compliance manual. There's 50 to 100 policies. Why? That's overwhelming. We want to keep it simple. We've tried to keep it as simple as possible. These are the 19 policies and procedures that we've come up with to put in our compliance manual. Let me show you a simple one. Policy 1.1, quality of care. Here's the policy. It is our policy to provide our patients with the highest quality care. Yeah, that's a good policy. What's the procedure? What are we going to do? We're going to do an initial history. We're going to do an exam. We're going to take x-rays or refer out for diagnostic tests. We're going to put together a logical plan of care. We're going to do re-exams and appropriate patients' progress. That's a beautiful policy and procedure to have on quality of care. Nice and simple. Next, policy on employee training. Many of you do trainings, but you don't document it. You don't address it properly. So here's a formal way to address employee trainings. How much training is required? 3 hours per year. I didn't say 3 hours per week or per month. 3 hours per year. That should be so simple to achieve. So we have a policy on employee training. A form gets filled out, a training log, an Excel spreadsheet. How about internal reviews and monitoring? I mentioned that. What's the procedure? Well, first the policy. The policy is the backbone of any compliance plan is reviewing, auditing, and monitoring components. Without them, we would not know if we were being successful in our best efforts to be compliant. What's the policy? There it is. What's the procedure? 5 patient charts every 4 to 6 months would get pulled. That's for a typical practice. Now, we have some clients that are seeing 500 a week, 1,000 visits a week, so those offices need to pull more charts every 4 to 6 months. And we have an Excel spreadsheet. It's an audit tool I've created that it's a checklist. And doctors, you could have a staff member do this. It's not that hard. Concerns. Have you ever had a patient have a concern? You're billing my insurance company too much. Why are you charging me a $50 copay when my EOB says I don't have to pay anything? Are you ripping off my insurance company? Dr. Kotler, you billed for a service I wasn't even in that day. Have you ever had a patient have a concern? How do you handle it? There's policies on documentation. Employee concerns. This is rare, but you may have a staff member, a doctor, an associate doctor, or maybe a front desk receptionist that comes up to the chiropractor and says, I don't think we're billing properly. Why are we waiving deductibles? Why are we using the same diagnosis codes on every patient? So there's a policy on employee concerns, disciplinary action I mentioned, prepays, discounts. Do you offer prepays and discounts? Sure. Some offices, they offer a discount to patients only if they commit to care. I don't agree with that. You can't hold the patient hostage. Only if you commit to 80 visits will deduct a few dollars off the fee. I don't agree with that policy. Deductibles, copays, coinsurance. Is it okay to waive copays, deductibles, and coinsurance? I know all of you are saying, no, wrong answer. The answer is maybe. There are certain instances where it is totally legal and 100% okay to waive copays, deductibles, and coinsurance. Target coding members, you know what they are. Stark laws, anti-kickback statutes. Yes, let me give you an example of how you may be violating this and you don't even realize it. Mrs. Jones comes in. She has a $500 deductible, and you want to be a nice guy. You're going to waive the $500 deductible because this patient is committed to 30 visits, and you're going to eat up the deductible. Yum, yum. You're going to eat up the deductible really quick, so you're not going to charge the patient the $500. You think you're being a nice guy. Not a good way to do it. If there's an investigation, an investigator looks at it differently. This is how an investigator looks at it. See, being in practice is one thing. Now, knowing what investigators are looking for, that's my area of expertise. I know what investigators and auditors are looking for because of my 15 years of experience dealing with medical directors, insurance companies, auditors, investigators. I help negotiate settlements on behalf of chiropractors nationwide. I've saved chiropractors millions of dollars because they were asked back for money by insurance companies, and I was able to negotiate that amount way down, even without an attorney. So the investigator looks at it differently. The investigator looks, oh, you took $500, doctor. You put $500 in an envelope. You took $500 cash, 5 $100 bills. You put that in an envelope and you handed it to Mrs. Jones on her first visit. That's what you did. You didn't waive the copay to be or the deductible to be a nice guy. You handed the patient $500 cash. So what is that considered? It's a kickback. Yeah, it's a kickback. And what does that do? That violates the anti-kickback statute. A couple of other policies here. You should be documenting every person that has access to your patient information. That's the authorized access of computers, policy 10. Accurate claims processing, record retention, background checks. You should have a policy. Every person that works for you, you should do a background check. I have a website that you can go to. It's free. You could check to see if any person that works for you has been convicted of a crime where they've been kicked out of any federally funded programs. Do background checks on every person that works for you. Here's some more policies. Overpayments. Policy number 17, services specific to the practice. This is where we get very detailed on the offices that we work with to create a policy manual. Many offices will do cash-based services like laser, decompression, shockwave. What's your policy on that? Are the devices that you're using FDA cleared? Does insurance pay for them? Do you do red light therapy, weight loss programs, functional assessments? Some of the offices we work with do stem cell injections, trigger point injections. So we go over services specific to the practice. Policy 18, exit interviews. Yes, you may have a staff member that's quitting, resigning. It'd be nice to do an exit interview. We'll show you how to do a compliant exit interview. And policy 19, we give you a sample annual assessment and calendar. So that's section 1. Send in your questions to info@targetcoding.com if you have any questions on section 1. We're going to move down now to section number 2, which are the forms. You need to have good quality forms. These can be digital. They don't have to be paper forms. Everything we give you is digital. Now, we have some offices, I'd say 20% of the offices, they want an actual hard copy 3-ring binder with all the paper forms. 80% of the offices want our digital compliance manual. So you know what we do? We give you both. We'll give you the digital, we'll give you the hard copy, and you decide which one you prefer. So here's a sample. Every employee that has anything to do with billing and coding should sign your employee acknowledgement form, that they acknowledge that they've read your policies and procedures. They understand them. They agree to follow them. If they don't want to sign this form, it's grounds for immediate termination. Employee acknowledgement form. Now, this is not the same thing as a policy on vacation time, sick time, all of that. That's an employee handbook. That's separate. I mean, we have that. If you would like to include that with your policy manual, you can, but that's a separate policy on vacation time, showing up on time. You can't smoke cigarettes at the front desk, you know, a policy handbook. That's separate. This is a billing and coding policy manual. So anything to do with billing and coding, that's what you're going to have an employee sign this form. You're going to assign someone to be the billing and coding office manager, needs to sign this form that they will update the policies and procedures. This is the employee access authorization form. All of these forms are available in Excel spreadsheets. We're just showing you the paper forms. Here's the patient complaint form. Oh, by the way, you may be wondering, where do I learn all this information? Whenever I do my live seminars, oftentimes on the breaks, a lot of staff members and some chiropractors, they want to know, how do I learn all this information? How do you become certified in billing and coding and compliance? Well, you'll need to read a lot of these books you should see on your screen. You'll need to review policy manuals from Medicare, Aetna, Cigna. We stay up to date on the latest in billing and coding and fee schedules. Aetna, Cigna, Blue Cross Blue Shield, ASH, American Specialty Health, United Healthcare, Optum guidelines. Just about every week I refer to the Medicare Claims Processing Manual. Now I know all of you are saying, We would rather have root canal than read these manuals. So that's why at Target Coding we say we read all the fine print so you don't have to. So, and we all have strengths and weaknesses. I really enjoy reading these updates. I don't find billing and coding and compliance boring. I love what I do. You could probably tell from the passion in my voice. I also get these alerts directly from the OIG, medical doctor insurance fraud, nurse practitioner insurance fraud, chiropractor. Here, look at this chiropractor convicted of insurance fraud, sentenced to 30 months in prison for defrauding the NBA Players Health and Welfare Benefit Fund. What did he do? What did this chiropractor do? This chiropractor is in big trouble because she was using a technique she learned on YouTube. What's going on? Now, here's a podiatrist convicted of a $4 million foot bath fraud scheme. What are these healthcare providers doing? I read this. Why? So I could learn and then help the entire chiropractic profession avoid these horror stories from occurring. How do I do that? We send out an email newsletter to over 20,000 offices nationwide, and we share these horror stories so you could learn and stay up to date and prevent problems from happening. Here's a physical therapist, 2 years in prison for insurance fraud, a physician assistant, even a billing company, owner of a billing company, convicted of health insurance fraud. Okay, back to the program. Section 3, carrier policies and compliance documents. We include a background check. We start with the doctor. Here, I did one on myself. This was a background check. No problems. This is the website, exclusions.oig.hhs.gov. We provide you with the documentation requirements for your exams and re-exams. Who is this based on? It's not based on your state association. This is based on the AMA guidelines. This is what every insurance company follows. Therefore, if you do it across the board, you'll be able to sleep well at night. We also give you, if you see Medicare patients, we'll give you the policy guidelines for Medicare Part B, from Medicare Part C, those are also known as Advantage plans. We'll give you the policies from Blue Cross Blue Shield, Aetna, Cigna, United Healthcare. Every insurance company that you bill will give you information on the no surprise law, good faith estimates, policies on gifts. Do you offer free exams? Many chiropractors offer promotions. $49, come on in, exam, x-rays, and an adjustment. All of that for $49. It's a great marketing tool. And marketing companies will tell you it's okay. Careful getting compliance advice from chiropractic marketing companies. I don't teach marketing. Compliance, practice management, and marketing companies shouldn't teach you billing and coding compliance. Prompt pay discounts. Can you give patients discounts? Let's say your normal fee is $100 per visit. Here comes a patient, no insurance. Can you give them a discount? Absolutely you can, but there are certain limitations on the type of discounts you can provide. Prompt pay discount, time of service discount, administrative fee discount, you could interchange those terms. So we'll show you how to audit your policies and procedures. We'll give you policies and procedures. Just a few closing comments. We can provide you with a compliance, billing, and coding procedure manual. A couple of other closing comments. We have options to fit every practice. Cash practice, insurance practice, in-network, out-of-network, Medicare, PI, workers' comp. I have a menu that I want to show you. Target Coding offers 14 different products and services. You should see them on your screen. We offer webinars on 25 different topics. SOAP notes, Medicare, treatment plans, modifiers, managed care, neuropathy, decompression, shockwave, laser, PI, decompression, back braces, how to scrub EOBs. Most of our webinars and seminars are approved for CEUs. I've also written a book It's a book on the best codes to improve reimbursement. It has 3 chapters. Chapter 1 shows you the codes that pay for the most visits, like sciatica. I also show you that's 18 to 24 visits. I'll also show you the codes that pay 6 to 12 visits. Those are short-term treatment codes. And moderate-term treatments, it's 12 to 18 visits. You get this in a book. You get cheat sheets emailed to you. You also get, in section 2, show you how to pair your codes. Do you pair food and wine? Do you pair peanut butter and chocolate? I'll show you how to pair your codes. Your CPT codes are what you're doing, example, mechanical traction. Your diagnosis codes are why you're doing what you're doing. So mechanical traction pairs beautifully with radiculopathy and back pain. Myofascial release, 97140, pairs beautifully with myofascial pain syndrome and herniated discs. Section 3, I put on my clinical hat. I've checked with some other clinical experts in the field to put together 25 of the most common chiropractic diagnosis codes and a little checklist, the orthopedic, neurological, chiropractic, and subjective tests for the most common diagnosis codes, ortho, neuro, chiro tests. It'll help you sleep well at night. It'll help you get paid better and faster. You'll also get these cheat sheets that show you how not to combine certain diagnosis codes. For example, if you bill M5116 for lumbar herniated disc, don't also submit on the same claim M5416, lumbar radiculopathy. If you use muscle spasm and M79 codes, there's a chance the claim is getting denied, and you might not even know why. So that's why this book will help reduce administrative burden. CAs love this book. You could use these, you could take a page out of this book and use it as the topic of the day for training. It has the best PI cheat sheets in the industry that'll help you get paid better and faster. What else do we do? Yes, of course, we put together billing and coding policy and procedure manuals. We went over this in detail, disciplining employees, deductibles, co-pays, documentation. When should you document? Right at the time of service? Is it okay to wait the next day? I go over that in the policy on documentation. Now, if you don't have good documentation and you have to send in your notes, you might get a letter like this from Cigna. They want $250,000 back. We've dealt with numerous doctors on how to negotiate. Here's another one. A client of ours was asked for notes, sent in the notes. This was before he became a client. Bad documentation. The insurance company said, well, this is good news and bad news. The good news is they didn't ask for any money back. The bad news is they put this doctor on a prepayment audit, which causes chaos and problems. Now, if you ever have to send in your notes to an insurance company, you want to get good news. Here's one office we helped. This office, very busy practice. She sees about 80 patients a day. We helped her with her documentation. She had to send in her notes, and then she gets this letter back. It says, based on the documentation reviewed, we found that all services submitted were reasonable and necessary. It also says, we applaud you on your billing accuracy, and we encourage you to continue your current billing practices. This is from an insurance company applauding this chiropractor on her billing accuracy. This is not good news. This is fantastic news. Okay, what else do we offer at Target Coding? We have our CATS program. That's an acronym for our Chiropractic Assistant Training Series. These are 6 CA boot camps. These are fantastic 1-hour programs, especially for brand new CAs. We go over in class number 1, spinal anatomy, new patient onboarding, chiropractic terminology, insurance verification. In number 2, we go over how to fill out the 1500 form. This is even good for seasoned, even if you have a CA that's been with you for 15 years. This is excellent information. You'll learn a lot. So in number 2, we show your staff how to fill out 1500 form. 1500 form has 33 boxes. We go through every single box in detail. We also go over how to interpret insurance EOBs, how to analyze EOBs. In number 3, we go through the Medicare guidelines, the ABN forms, how to manage care, how to complete pre-authorization forms, which many of you that are in network, you're required to fill out pre-authorization forms. In number 4, we go through record keeping. We show CAs how to help the doctor do the SOAP notes and how to prevent the most common SOAP note mistakes. In number 5, we show CAs the most common diagnosis codes, modifiers, rehab procedures, modalities, how to bill for time-based codes and unit reporting. And number 6, we go through HIPAA compliance. We also offer memberships. We have 4 levels of membership. Level 1 is $99 a month. Do you know that this is a free webinar, but most of our webinars, there's a fee. Most of our webinars, we charge $99. We do 4 to 6 webinars every month. So that's $400 to $600 worth of webinars a month. If you're a level 1 member, you can come and attend all of them for $99. Even if you attend only 1 webinar a month, it makes financial sense to become a level 1 member. Level 2, we get into more information. Level 3 includes a billing and coding compliance manual. So level 3 members, you get a billing and coding policy and procedure manual and a HIPAA compliance manual. That's another manual that we provide. HIPAA manuals, which is mandatory. Every one of you are required to have a HIPAA manual. I would say at least 50% of you don't have one. If you get pulled over by the HIPAA police, you're looking at a possibly $50,000 fine. That's what they start at. We do chart reviews. Send us some files. We'll do a deep dive on your files, and we'll let you know what you're billing properly, what you're not billing properly. If you're leaving money on the table, we'll review your codes, your fees, your modifiers, all your intake forms. It's a wonderful program. Let us know if you're interested. We do credentialing. Yes, we'll help you get in network with Aetna, Cigna, United Healthcare, CAQH, ASH, Optum, Medicare. Hundreds of doctors use us for credentialing. We also sell forms, logs, fight back letters, templates. The forms that I showed you in this free webinar come from this package of forms, and we break it down. New patient forms, financial administrative forms like financial hardship forms, consent to treat minor forms. An attorney asks you for records. What letter should you send the attorney? Sample treatment plans, a whole bunch of sample SOAP notes, fight back letters. You get all of our HIPAA forms, Medicare forms, ABN forms. We have hundreds of testimonials across the country. We do seminars in very boring places, like on cruise ships. Many of you have attended our cruise seminars. We have our 3rd annual cruise coming up later this year. It's approved for 6 CEUs in over 35 states. So much fun. I get a conference room. I speak for a few hours. We're done by 11 o'clock. At 11 o'clock, go have fun. Go snorkeling, go scuba diving, go sit by the pool and drink margaritas all day. We go to St. Martin, St. Thomas, the Bahamas. Contact us if you're interested. We also have a program on how to become a concierge chiropractor. Many medical doctors are switching to concierge medical services. Well, why wouldn't chiropractors want to do the same thing? If you're interested in learning how to become a concierge chiropractor, send an email to info@targetcoding.com. Please check with all the carriers prior to submitting claims to ensure it's compliant. We can't guarantee this information will guarantee payment from any insurance company or patient. We're not responsible for any laws or rules that may change following this presentation. And you know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars and webinars and join your national and state professional associations. What you should do is follow us. If you're not a member of Target Coding, at a minimum, follow us on Facebook, Instagram, YouTube. Check out our YouTube channel. I have over 100 free videos on YouTube. There's my contact information. Email info@targetcoding.com. Website targetcoding.com. Telephone number 1-800-270-7044. Yes, we still have a few chiropractors that want to fax us information. So we have a HIPAA secure fax number 1-844-831-2347. Feel free to set up a free consultation, or if you'd like us to do a practice analysis at no charge. Normally we charge $350. If you'd like to do that, it could be as simple as scanning that QR code you see in the bottom right corner, or you can give us a call or send us an email. So again, I want to thank everyone for attending. Send your questions to info@targetcoding.com. I hope you learned a lot. Take care, everyone. Bye-bye.